Okay, so next we've got Margot Deuis. Margot is a nurse from Riverina Medical and Dental Aboriginal Corporation, and she's been working in Aboriginal health since the 70s, but in Rivermed for the last 10 years. And yesterday Margot mentioned to one of our QAAMS team that even though they have a pathology laboratory across the road from her clinic, she never once sends a single HbA1c there. Instead, she does them all herself on the DCA. So I think that's a really great point, and she's doing great work there. So I'll let her tell you all about it. Morning, everybody. Okay. Now, I'd like to acknowledge the Larrakia people as custodians of the land and the elders, both past and present. The DCA in diabetic management, and this is definitely from a primary healthcare perspective. From a personal point of view, I think the DCA has been one of the most dynamic, effective ways to give back to a diabetic client some power. And it's simply from the fact that it's there, and now that's when they're interested in their health because they turned up to see you. Okay, there's a few terminology changes. HbA1c we call the long-term blood sugar. Blood sugar, the BSL, that's the here and now blood sugar. We tend to get them a bit mixed up. We do not use the term diabetic educator at all. We've found it's incompatible. People won't see the diabetic educator, but they will see the diabetes nurse or the nurse. So we just don't use the terminology any longer. This is our DCA. We only have one. Everybody else seems to have multiples. So we have one, and this is in our, we have a diabetes chronic care and nurse practitioner, and it's in her room next door to mine. It's a bit cosy in there, but and as you can see, the calculator is up there where the client can see it. The calculator is probably one of the most effective ways of communicating what you're talking about to the client. If you want to call it the red traffic light systems, that's fine. But clients walk in, we'll show them where they are, show them what they're doing, and they will come and tell us then later on. So what does the DCA do? It allows on-site point-of-care testing of pathology samples for Aboriginal and Torres Strait Islander diabetics. The long-term blood sugars or the HbA1c is done 3 monthly, and the urine albumin creatinine ratio is done yearly, or PRN. And what does it do for the client? Well, it allows confirmation of diagnosis, except in pregnancy. The convenience of on-the-spot confirmation of diagnosis in 6 minutes is really very important. We've had trouble, and I'm sure all of you have had trouble, in trying to get clients to take glucose tolerance tests. There is always travel, family, transport difficulties, distance from the pathology units. It's really very difficult. And then you've got grandparents who are first carers for their families, for their grandchildren, and they just don't get there. It's as simple as that. So with confirmation, we can get a yes or no diagnosis on the spot. We go straight through to what it is, straight through to treatment, and it starts. Or if it's a no diagnosis, then you've got no problems. You try and get them on. If you have been doing the test in the first place, you're probably on that borderline, so we can give them some information on what would be beneficial to them. Ease of collection. Both for the long term and the short term, you can take it on one little finger prick, and this, many pathology units take IV blood. And with your patients with needle phobias, they won't even go to the pathology unit because pathology units take IV blood. You can usually talk most clients into doing one finger prick. That gives you a very good idea of where you're going. And the answer's back. People don't turn up to the doctors unless they're sick. They don't come in because they feel like it. And also, the DCA also gives some of the management power back to the client. A large number of clients only see the doctor when they're sick. Usually this means that the observations taken at that time are not optimal. This is especially true with blood sugars. This can lead to a situation where every time they see the client, the client sees the doctor, their levels are concerning. The doctor then stresses the need for better control. The client gets upset because every time they see the doctor, it's the same answer. And they'll tell you, I've really been trying. Before the DCA, clients would sometimes change their lifestyles so they could get a more normal blood sugar when they walk into the practice. Now that doesn't happen. Now they know that if they've been partying for the last 3 months, I'm not going to know about it. But even more importantly, if they have been trying, even though their blood sugar today is terrible, it will show up on their long-term blood sugars. And that's really had a very positive effect on our clients. And the other thing is, many of our clients now walk in and remind us that their long-term blood sugar is due. And that will be even before we've turned on the computer to their page and the light system has come up. They'll know, oh yeah, my long-term blood sugar is due now. And they really have taken that back into themselves. This is Alice. As you can see, Alice is an example, she's been diagnosed for 8 years and she commenced on insulin 3 years ago. She came in May feeling sick. Her blood sugar was 16.2 and she was really quite upset because she said, I've been really trying. And she didn't seem to be getting anywhere. I mentioned the long-term blood sugar and immediately came back with, I don't want to know. So we sat down and we had a talk about what Alice's results were over the last few years. And the fact that she'd been down as low as 90, and even though at the time she arrived, the blood sugar before that, which she hadn't stopped to even talk about, had been 140. Sorry, 130. Okay? Once she understood what those readings were, she came back with, I'll try harder. The interesting part about that little statement was, and Alice comes from an area where a lot of their members are diabetic and they're in the same groove. So she came back in August with a blood sugar of 102. So what did this mean for Alice? Well, research shows if you reduce your blood sugar levels by 1% or 11 millimoles, there's 90% less eye problems, 16% less heart problems, and 43% less amputations and all that sort of stuff down the track. By explaining to Alice what the long-term blood sugars meant, Alice chose to apply the information to her life and in a 4-month interval had reduced her long-term blood sugars by 28 millimoles. Knowledge is definitely power. Without the DCA and the immediacy of the results it gives, the motivation necessary to get healthier may have been lost. It's easier to be encouraged if you've got something physical to get encouraged with. And the 28 millimole improvement is a physical change. Outwardly, Alice looked exactly the same. She was the same weight, same everything, but she felt better. But there's always a but. Improvements in the long-term blood sugars, when you improve them, will improve your health, but the full benefit from these improvements long-term results must be obtained before irreversible body system damage is done. This is Bill. Bill's a 56-year-old Aboriginal gentleman. He's been diagnosed for 26 years. And as you can see, he's been very unstable for a long time. You can see he's also right at the beginning of the chart, his ACR levels are not good, and he's progressed all the way through until he was on peritoneal dialysis. This section down here is where he started to get control. But the problem was control, he did not get the full benefit of that control for his life period because the damage was already irreversible to a lot of his systems. And with Bill here, it was amazing. He came in and he was blooming once we get control. And they all say the same thing. They all say the same thing when diabetics get better control. I feel so much better. I'll never go back to feeling what I was before. But you need to get that encouragement before you get to this big problem. Bill then started going back to play sport. He was, he was going out. He was doing all these things. But the damage was irreversible. He ended up with peritoneal hemodialysis. He's got all the rest of the bits there, and amputations. He's had progressive amputations down the track, and that's really depressing for everybody because he went from this I feel great part, but it didn't seem to make as much difference, and it didn't, unfortunately, for Bill. Improvement in family harmony. The DCA, anyone who lives with a diabetic member of families will know that when diabetics are unstable, so is their tolerance factor. You don't have to know your blood sugar. They get short-tempered and angry. The shorter the temper, the more unstable the diabetics usually. As I said, you don't need to know that you just tiptoe around for a while and yes, will hopefully come good in a day or so. Okay? The DCA can give diabetics the incentive to improve. It did in Alice. She'd been intractable for a long time until we sat down and explained exactly what it meant. Now she's taking control. She didn't do anything better. She still didn't go to the dietitian. She still had performed everything else, but she took ownership. It'll be interesting to see what the next one is. Now, if they do take ownership of their diabetes and follow it through, successful improvement in family dynamics will happen because they'll feel better. Thank you.